Are you in every way, woman?
Welcome back to Every Way Woman. We're talking breast cancer and specifically a high risk in genetic testing. Dr. West, there's been a lot of evolving in this field.
It's been mind-boggling what's happened in the last 10 years since they discovered the BRCA gene. But this has been a great thing that we've been looking forward to, is identifying who are those women at high risk, particularly if we can catch them at a young age, and then offer them risk reduction therapy, medications, careful follow-up with MRIs, or even nipple-sparing mastectomies, which has become a procedure that's been very, very effective. So it's a little complicated for an old guy like me to kind of put all these things together. It's moving so fast that we get...
But it's exciting.
It's so
exciting.
Wait,
Dr. West just said nipple-sparing. What is that?
It's what you do if a woman has kind of hanging breasts and she has breast cancer. You can lift them up, scoop out the breast tissue, and give them beautiful 16-year-old breasts.
And they
look
keep their
better
health.
than they started.
But you know, not everyone.
Not everyone.
We don't want
Hey,
to
it sounds good.
promises. Right. Curcio, I'm really fascinated by this. When you're doing that genetic testing, what are you testing for? He used the gene, but I want to know, what are you testing for?
We're actually testing your genes. And we all have these genes that we're looking at. And a lot of these genes are involved with repairing changes that occur in the cell that could lead to cancer. Wow. So when a normal cell starts to make those changes to go down the cancer route, these genes' job, part of your immune system, is to say, these are bad changes. Let's repair it. And if we can't repair it, let's destroy that cell. The BRCA1 and 2 gene, for instance, is one of those genes that's responsible for DNA repair. Yeah. When those genes are broken, they're no longer doing their job, and then cancers can occur. And the problem with the BRCA mutations is the cancers can occur, and sometimes they can occur very young.
So who are the candidates then for these?
Well, you have to look for them. They don't just pop out and say, I need to be tested. You actually have to look at their family history. If they have multiple relatives with breast cancer, or one relative with really young breast cancer, like age 30 or even younger, or if they have someone who has had bilateral breast cancer, or there are certain ethnic groups that have an increased risk to have these mutations.
What are those ethnic groups? What is that?
Well, one of the main groups is Ashkenazi Jewish women have a much higher risk of being BRCA positive than a Caucasian woman or an African American.
Okay, so how are these tests done? Is this an invasive?
And this is definitely different from a genetic test. I'm
part
from this tribe. Yes, I'm part this tribe. This is more genetic.
And it's different than the genetic test that you have when you're pregnant to make sure that everything's okay with your developing embryo. These are tests that actually are just a blood test, but they're looking at the genes that make you up. And they're not looking at every single gene. They're looking at the genes that we know do these jobs and could potentially, if they're not working properly, cause problems or cause an increased risk for cancer.
So then the testing is really not that invasive. It's just a blood test.
It's a blood test. It's a blood test that gets drawn, and then they put it through a machine. They do something called a polymerase reaction test, like a PCR. And so you're essentially looking for these genes, as Dr. Curcio said, looking at a pattern mapping, and then you look to see if they light up or not, and it tells you whether that gene is mutated or not.
It's extremely
It's very accurate. It's about 98.6 or something percent accurate. Very accurate.
You could tell me by looking at that test if I will have breast cancer.
No, and none of those genes, not a single one, says 100% risk that you'll get breast cancer. And some of them now, we know genes that attract with other cancers in addition to breast cancer. But for instance, like the BRCA gene, the risk, it can be as high as 86%. Then there's other genes that are less. But the power of this test is, for number one, someone who's had cancer, that they might be at higher risk to get a second cancer. So maybe doing a lumpectomy is not the right operation for them. But even more so for someone who hasn't had cancer to prevent a future cancer.
So, Dr. Curcio, I get this blood work done. What's the result? What do you tell me in my consultation?
Well, when we get the test results back, I'll tell you if your genes appear to be normal, or if they have a change that we know can lead to cancer. And then, like a lot of tests, there are these intermediate test results, which it's not a normal gene. It's not the changes we know.
Live in the shade of gray. I mean, don't women live in fear then? Like, oh, I'll probably get breast cancer because of this? I would assume.
Right, but what age should you get that done? Should you get that if
it depends
you have the
on
mammogram and they suspected something, or do you... just do the blood test?
No, we are testing people based on their family history. Your mammogram doesn't drive these decisions. It's really based on the family history.
So it's something for young women, essentially someone like me in my late 20s. It's something I would want to consider.
Absolutely. Well, if you have
family history.
But I think
you have
this
to
is
have
a
that
changing
information.
ballgame. It was we would only look at very high risk families, breast and ovarian cancer, early onset, and then we'd send it off to Myriad, which is the only place doing it, and it would be $5,000 out of pocket. Well, that's a real barrier. Now we can get more information for $100 out of pocket for women who either HMO covers it or all the PPO patients. So this is going to get less and less expensive, and I can see a very Claire King, who actually found the BRCA gene, has now made a statement that she thinks every woman at age 30 should have BRCA testing.
And I would agree with that. More information when we come back on Every Way Woman. Stay tuned.
Are you in every way woman?